We're delighted to have started our complex spine fellowship here at Penn. This is fairly young. We're in our second year, but we've already trained two of our internal fellows. I believe we have the volume at Penn to support one of the best fellowships in the country and possibly the world. We do 2,000 to 3,000 spine cases a year across hospitals. Many of these are very complex. I feel we're in excellent position to train the next generation of leaders. They can expect a very diverse exposure to spine surgery, and we do want to individualize our fellowship based on the candidate's goals. Everything from maximally invasive, such as deformity, to minimally invasive endoscopic spine surgery, spine tumors, spine trauma, degenerative spine, and everything in between. There's no type of spine surgery that we don't do here in high numbers. And I think that if a fellow desires or foresees himself doing a certain type of surgery more in the future, we will obviously accommodate that, but in general, we want to expose them to all of it. There are several ways that the fellowship will prepare the fellow for the next steps in their career. The first is attaining technical skills in the OR in a very broad array of cases, but also the outpatient and non-surgical treatment of these patients, both preoperative and postoperatively. We believe surgery should always be a last resort, and I want them exposed to everything we do and say in the clinic, and how to obtain patients' trust, I think, is a very important thing. And lastly, academically, our expectation is very much that the fellows will continue to write and contribute to spine literature, as well as give talks in the country. And together with background and prestige of coming from Penn, our intimate connections throughout the country with other spine surgery directors, we feel we're in a good position to place them really wherever they want to be. Spine surgery is something that's constantly evolving. The education and training never ends with your training. We constantly take courses throughout the country, attend national and international meetings. We have to absolutely stay abreast with all the new instrumentation and techniques, but be selective about them. Not all of them are necessarily the best for each patient, but when and if they are, we have to learn how to adopt these and constantly change. That's the only constant in spine surgery, really. I think the volume, the diversity of the cases is probably our strongest asset. But also we have 8 spine faculty, all of whom are nationally and internationally renowned. I think that the fellow will gain skills from each of them, merge them together, and come up with their own style, but they'll be training with some of the best surgeons there are.